Because this one is disposable, once it's getting full, you need to change it. Changing it should be by using a sterile technique. Cross clamp the chest tube close to the patient chest, disconnect the old tube, attach the new system, unclamp the chest tube and check the connections, assess for the function of the drainage system, and ensure the chest tube is clamped as briefly as possible. Ensure your clamping is not existing for a long time, as briefly as possible. Clamping the chest tube poses a risk of tension pneumothorax. Always keep the suction chamber open to the air, or the suction control stopcock is open. Do not close that one. Do not clamp it. This will allow the air to exit and minimize the possibility for tension pneumothorax. Now, if there is order to take specimen from the system, maybe in another model there is a port for the sampling, but in this model, based on the manufacturer, you need just to make dependent loop, clean it with alcohol, and use a small needle less than 19 gauge in oblique angle. You can take your sample. Now, for the milking, do not milk or strip the entire length of tubing. These practices increases intrathoracic pressure. Do not clamp the tube for extended period, because doing it will increase the developing pneumothorax. Clamping only 3 scenarios. First, to detect the air leak. Second, when we are changing the system. The third one, if there is an order from the physician to clamp and observe the patient, and usually before removal of the chest tube.